earlier years, chemotherapies were available mainly as injections, and then after, with time and with modern medicine, there are large number of chemotherapies which have actually been available in the form of tablets as well. Like you have a tablet called capecitabine, which is used for right from certain types of breast cancers and for almost whole of the GI tract, right from the esophagus, stomach, colon, rectum. Then you have some tablets called temozolomide, which is also a chemotherapy drug, which is used in brain tumors. And then after you have the other tablets. What are the other tablets? These tablets are called targeted agents or TKIs, tyrosine kinase inhibitors. So these are used for like lung cancers. You have some for breast cancers, and then after for liver cancers, pancreatic cancers, and so on and so forth. You have some for a condition called GIST. Then after you have certain tablets, these TKIs which are used in a leukemia. Leukemia means a blood cancer, like a condition called CML or chronic myeloid leukemia. So there are a lot of IV chemotherapies, and now with time, large number of tablets have also entered into the market, making cancer a chronic disease like diabetes or hypertension, where you don't need the IV for a long period of time. You can make do with the tablets as well. So it doesn't preferentially affect the cancer cell per se, but normally let's consider you have a multiplication factor. That's from one cell to become two cells. Let's call that a factor X for normal cells. In cancer cells, that factor is sometimes 5x, sometimes 10x, sometimes 50x. So it multiplies so rapidly. So it needs more nutrients. When you give chemotherapy acts against rapidly dividing cells. That means cells which keep multiplying again and again and again faster, they will need all the raw material. It will take in the raw material, it will take in the chemotherapy as well. The chemotherapy enters into the cell, intercalates with its DNA. DNA is the structure through which the cells keep dividing, right? It intercalates, it blocks it. This is one type called alkylating agents. Therefore, it prevents the cell from multiplying and kills the cell. In other types, the raw material of the cells like pyridines and pyrimidines, those you have these purine analogs and pyrimidine analogs. So if you give these type of drugs, they again enter into the tumor cell preferentially when compared to the normal cell, and then afterwards incorporate into it, and then it kills it. So therefore, both good cells and bad cells die, but the bad guys die a lot, and the good guys or the good cells, very few of them die. Like what do we see? You have some infusion reactions. Then afterwards you have some vomiting which might occur. Then you have fatigue. Then long term when you see, you can have some hair loss, you can have neuropathies, that is nerve problems, which we call it for common man. Nara problems are kind of something they say. So to prevent the infusion reactions, andre drug hatsiruvaga the kind of reactions that the people have, adana ನಾವು ತಡೆಗಟ್ಟಕ್ಕೋಸ್ಕರ we give pre-medications. ಒಂದು steroids ಕೊಡ್ತೀವಿ, so many other drugs ಕೊಡ್ತೀವಿ, cocktail of medicines ಕೊಡ್ತೀವಿ. So therefore the side effects come down. So infusion ಆಗ್ತಿರುವಾಗ ಏನು ಸ್ಮೂತ್ ಆಗಿರುತ್ತೆ. Patients will be like, ಸರ್ ಕೊಟ್ಟಿರೋದು ಗೊತ್ತಾಗಲೇ ಇಲ್ಲ ಸರ್, nothing happened to me. We're like, wait for the magic to kick in. Then comes the fatigue. So now for fatigue, there are no effective therapies. For the vomiting, we have good drugs. To prevent reactions, we have good drugs. So people don't vomit anymore. Very few people who do vomit. So the fatigue, we don't have an effective therapy. The only therapy that we know is exercise, drink lots of water, and take rest for 2 to 3 days. Then the fatigue goes away. When you look for hair fall and other stuff, some chemotherapies, hair fall is inevitable. Hair will grow back after some time. Well, pretty much these are the common side effects, and this is how you handle them. We can actually divide this particular topic, what are the long-term effects of chemotherapy, into few parts. We can have effects on the heart. There are drugs like anthracyclines, it becomes like a rasna color for breast cancer which we give, and it's called adriamycin or epirubicin which we give. That kind of drug has a small percentage, around 3 to 5% chance, it can cause something called cardiomyopathy. That is, it affects the muscles of the heart, where the heart becomes flabby and the patient goes into a congestive cardiac failure. These are not very common, but occurs around 3 to 5% of our patients, and we've seen many of our patients who have suffered with it, and we've been able to help them come out of it. Then afterwards, what is about the heart? Then afterwards, you have toxicity to the lung, like certain drugs like bleomycin and other drugs which we use for different cancers, like sometimes head and neck cancers, sometimes like lymphomas, like Hodgkin's lymphomas. They can cause fibrosis. The fibrosis means the lung, which has to be like a nice honey cake, will become like one rusk. So therefore the breathing, there is the oxygenation, everything gets impaired. Then some patients, you will see that after taking chemotherapy, they are prone to develop second cancers by virtue of taking these chemotherapies to cure one cancer. After some time, there is a small percentage, 1 to 2% chance they can develop a second cancer due to this. Like again, drugs like anthracyclines, when used for various different cancers, there's a 1 to 2% chance of getting a condition called acute myeloid leukemia or a blood cancer. Now, this doesn't mean that you stop taking chemotherapy. There are certain risks. When you take your bike and you go, one building can fall on your head, or a rocket might fall on your head, or you might get meet with an accident. It doesn't prevent you from riding a bike, right? Therefore, even these chemotherapies also, all side effects would be there. But if given in a proper proportion with a lot of, in a graded manner, you can prevent these complications to a large extent. Another problem which the patients come with is peripheral neuropathy. Sir, nara problems, sir. Nerves problems, sir. What does it mean? They'll have this tingling and pins and needle sensation in their feet and their legs. So that can also occur like in a set of drugs called vinca alkaloids or taxanes. While taking these medicines, you can have this kind of pins and needle sensation, slightly numbness of your feet and hands. Sometimes some people will get some amount of imbalance. So it's very important for you to talk to your doctor about all the symptoms which start occurring during your chemotherapy, so that the doctor can modify the therapy and sometimes stop the therapy if any of these symptoms are excessive. A lot of research over a large number of years, we have come to realize that even after removing a tumor, the disease comes back in 6 months or 1 year or 2 years. Then came the concept of chemotherapy, that if you had chemotherapy, you realize that these patients did not have the disease recurrence. Many of them did not have disease recurrence at all, and in some cases when it did recur, it occurred after 3 or 4 years or 5 years, and in very few cases it occurred within a year or two. When we started identifying the concept, we realized that there are a lot of cells while during surgery, while handling the tumor, the cells which might get interspersed into the blood. And even by nature of the disease, like if you have node positivity or the tumor is of a big size, you will have some amount of circulating tumor cells going into the bloodstream and going and seeding in certain organs like liver, lung, bone, brain, wherein it would start growing after some point in time. So these cells are not visible by any scan or any imaging technique. There are certain blood tests you can do to identify them, but normally these are the cells which will be there. It is a given fact that these would be going into the blood. So if you give chemotherapy, the chemotherapy goes all over the body. Wherever the blood flows, chemotherapy flows, and wherever the tumors pass through the blood and the lymphatics. So therefore, the chemotherapy would come in touch with that particular cancer cell and kill it. So this is how giving chemotherapy prevents or postpones cancer recurrence.